Hi, this is Dr. David Greene, founder and CEO of Regen Suppliers. Today we're talking about exosomes for Medspas. So in this brief presentation, I'll talk about what an exosome is, why are they unique, why have they become so popular with Medspas throughout the USA, and then we'll talk about our contact information for Regen Suppliers. Typical disclaimer, none of the information presented here has been evaluated by the FDA. No claims are being made as to indications for use. Any usage is up to the healthcare provider's decision-making process in conjunction with the provider-patient relationship. All right, what exactly is an exosome? Well, it's a term that applies to a tiny extracellular vesicle. They are acellular, they're not cells, that are produced by most cells throughout the body. They're present in all bodily fluids, such as breast milk, urine, lung fluid, semen, saliva. So they're not, specific to any one particular fluid. They are produced by cells, but as mentioned, they themselves are not cells. They don't duplicate, they don't go through mitosis. Exosomes are part of the heterogeneous extracellular vesicle category. There are actually three components. Could be a microvesicle, those are typically larger than exosomes. An apoptotic body, which is basically a dead cell, and those can be the same size as exosomes, so it can be a little bit confusing there. Exosomes are very, very, very small. They're 30 to 150 nanometers in size. They were discovered back in the 80s, and it was found that they carried proteins, small RNA, cytokines, growth factors inside them. If you look at this diagram, you can see that exosomes are formed by what's called an endosomal, inside the cell route, and are typically, as I mentioned, 30 to 150 nanometers in diameter. So if you look at this MVB, multivesicular body, think of it as a soap bubble, all right? And inside it are these exosomes that are clumped together, and they don't do anything, functionally while they're inside the cell being formed. Okay. Now, here you can see one of these multivesicular bodies having attached to the outer part of the cell, the plasma membrane, and then it releases those exosomes outside the cell into the extracellular space. That's why they're called extracellular vesicles, okay? We don't know a lot about that process of what compels a multivesicular body to say, okay, I'm going to go ahead and release my components outside the cell, now. How do they work? Well, when an exosome is taken up by a cell, they then release their payload. And inside an exosome, you have quite a few things: RNA, cytokines, growth factors, other proteins, and they can initiate a response in the cell that they end up in. Originally, back before we started to learn more about these in the 80s, they were thought to be a source of cellular dumping, or a way for cells to get rid of unneeded or unwanted materials, almost like a garbage truck, okay? Here's some examples of functions that we've discovered. They participate in cell-to-cell communication, which can promote cellular repair, new blood flow, etc. They can also participate in cellular maintenance. And for topical use, often in like Medspas, they can reduce the appearance of fine lines and wrinkles and help the skin have that glow, which makes people look younger. Why are they unique? Well, there's been a huge amount of interest in exosomes over the last 10 years. They are very, very small and acellular. So you don't have to worry about any cellular components having issues with, mitosis or replicating too much or things like that. They're about 1,000 times smaller than stem cells. So, providers don't have to worry about damaging a cellular component with a small needle. Cost effective, they're lower cost than most other tissue products. They have less restrictive storage requirements. So for instance, if you produce them with lyophilization, which is essentially almost like a freeze drying process, they can be stored at room temperature for months. If the lyophilization process is not used, they can still be put into a regular refrigerator temperature for a month and be fine, or a regular refrigerator or freezer for a year. And then at room temperature, they are good for 2 weeks. The results topically have been fantastic. The best exosomes are those that are made from umbilical cord mesenchymal stem cells. The mesenchymal stem cells are cultured at hypoxic nature, and then the byproduct is exosomes. The cells themselves are not used, they're gotten rid of, and the exosomes, along with the conditioned media that they're in, are utilized. Why are they so popular with med spas? Well, it's no secret that med spa competition in the United States is very high. They're always looking for a cost-effective advantage, and exosomes provide a great option for that. As mentioned, the storage requirements are easy. They're fine at room temperature for 2 weeks. Patients tolerate them topically remarkably well. We have not seen any reported allergic reactions or issues such as that, and have not seen that in the literature as well. Med spas are able to use them for various procedures. The decision of how to use them is up to each individual healthcare provider. And they have, as I mentioned, in the peer-reviewed literature, they have not been associated with allergic reactions or really other issues when used topically. So at Regen Suppliers, we offer ReBellaXO, which is a first-rate exosome product. It's produced at a CGMP-compliant, FDA-registered lab. It's been our top seller for years. The initial purchase with clients is for BOGO, 2-for-1, buy one, get one free, 1 cc or 2 cc vials. Currently, 1 cc is $7.75, but you get 2 vials, so that ends up being $300 and some dollars per vial, very cost effective. And for 2 cc's, that's $10.75. You get 2 vials of that. We don't have any limits on quantity. We ship overnight on dry ice. And then you can keep it on dry ice. You can put it in a cryogenic freezer, or if you're going to use them, you can just thaw them out and they'll be fine for 2 weeks. It's a great way to differentiate your med spa from the competition. More and more patients are learning about exosomes for aesthetics, and they're asking for them. So it's a great idea to incorporate them into your practice. To contact us, visit us at regensuppliers.com. A lot more information there. And you can call us at 888-568-6909, and we'll be very happy to help you. Thanks for watching.